Thanks for being here tonight. I'm Megan. I'm from the library, and I work with Advocate to help put these on, these series of programs. So we have Dr. Nayak here with us today, Dr. Veena Nayak. She's board certified in rheumatology and has been in private practice since 1997 and currently has a private practice in Olympia Fields and is affiliated with Advocate South Suburban Hospital. Dr. Nayak cares for adult patients and treats all types of arthritis, including rheumatoid arthritis, osteoarthritis, gout, psoriatic arthritis. Okay, you're gonna have to help me with this one.
Ankylosing spondylitis.
Ankylosing spondylitis and polymyalgia rheumatica.
Rheumatica.
Okay, I did okay on that one.
Yes.
All right. She also specializes in treatment of lupus and related autoimmune systemic connective tissue diseases such as systemic vasculitis and myositis, messed up on that one, fibromyalgia and osteoporosis. Dr. Nayak completed her fellowship in rheumatology at McGill University Medical Center in 1996 and published clinical research in lupus. Her internal medicine residency was completed at Montefiore. Did I get that right?
Montefiore.
Montefiore. Thank you. Medical Center, affiliated with Einstein Medical School in New York in 1993. She graduated summa cum laude in 1990 from a 7-year combined Bachelor of Science MD program and received her medical degree from State University New York Medical School at Buffalo. Thank you for being with us.
Oh, well,
tonight.
thank you. And thank you all for coming and taking the time out to come. I hope I am able to share some information on gout and answer your questions afterwards.
Yeah,
Let's
right.
move forward.
Yes.
Okay, so we basically, should I see you? Is this a good place?
Yeah, that's fine.
Okay, great. So this is basically a talk on gout, which is, of course, as we know, a very old condition that has been known to be around, and I would like to share some new perspectives on it. So gout, of course, as you know it, historically has been associated with eating rich foods, consuming excessive alcohol, known as a disease of kings, because obviously to be able to consume rich foods and excessive alcohol, we probably had to be able to have the means to do that. So that was unfortunately one of the things that royalty and others who could afford it succumbed to gout quite often. And we know that well. Now, interesting to know in modern day, gout is one of the most common forms of inflammatory arthritis. Stand on this side, actually. 9.2 million adults in the US have gout. Is cause sudden onset of acute joint pain with tenderness. That's the most common presentation initially. And one of the most common presentations is known as podagra. If you see over here, this is the joint of the big toe, which is the interphalangeal joint of the what we call the first metatarsal phalangeal joint. And that particular joint, when it becomes red, hot, swollen, and tender, is called podagra. And that is one of the most common forms of the acute presentation of gout. However, any joint can be involved. A person may come in initially with a different joint. Most of the time, it's monoarticular initial presentation, meaning one joint involved, as opposed to in certain other types of inflammatory arthritis, we may have polyarticular joint involvement most commonly as the initial presentation. So, what is it that occurs with gout? How do you get the inflammation? Initially, what we have is an accumulation of uric acid crystals that actually are floating in the blood, and they are at a higher concentration than what is considered homeostatic for the body. And at that level, it actually accumulates and starts to cause inflammation and swelling when that crystal deposits into a particular area, such as the joint. And that is what's going on over here. Oh, I'm not sure.
I don't think it works very well on the
Oh, okay,
screen.
no worries. Well, anyway, so here's the joint magnified. We have over here inflammation occurring with swelling on the outside where the redness and swelling is noted on the outside of the joint. Internally, however, in this area where the inflammation is, there are these very needle-like crystals that are seen under a microscope, and that is the uric acid crystal, which is depositing in that joint and causing inflammation. So that is the reason for the inflammation to occur. So there are some stages of gout. Initially, we have what's called asymptomatic gout, where you have essentially, this is occurring prior to the attack. There's just a higher serum uric acid level in the blood serum. And there may be no particular symptoms at that time. This is something that we actually call asymptomatic gout. Acute intermittent gout is when you start to have attacks which are occurring. Usually an attack will last up to 10 days, 3 to 10 days, somewhere around there, an acute attack. And generally, it basically is like a very high going up very quickly, and then it starts to peter out. So that's where the 10 days come about, causing pain, swelling, inflammation, redness. Even some systemic symptoms like fatigue and even fever can occur in an acute attack of gout. Then we have chronic tophaceous gout, which is the third stage, where in fact, this has occurred enough times that uric acid is chronically deposited into that joint area, resulting in what's called a tophus, which is basically an accumulation of uric acid turning into a hardened nodule. That tophus, which can be seen outside as a nodule, is an indication of uric acid accumulating, and with that is a correlation of bone destruction, erosion, and those type of changes that are actually occurring and causing destructive changes in the joint space. And that's what's going on over here in the area of a particular joint or multiple joints in chronic tophaceous gout.
Question, what is the typical time period or interval between the three stages?
It can differ. It may not even go to that level of chronic tophaceous gout. It really depends on the level of the uric acid in the blood, how high it's getting, and what are the instigators? Like, for example, we'll talk about, is there something that, is it because you're eating certain things? Is it because you're on a particular medication that's continuously causing the uric acid to rise without anything to reduce it? And those things will immediately determine a little more in terms of how quickly you'll progress. So it differs from each person. Also, there's so many genetic factors within each individual that will help to reduce the inflammation or continue to perpetuate.
Excuse me, and you said that it will actually destroy the bone in the joint?
It begins to cause erosive changes.
Erosion.
Yeah, erosions, which is one of the hallmarks of many of our inflammatory arthritis conditions. And so that is why it is important to treat the uric acid in the first place, once we know that there is an episode of gout happening. So risk factors that increase uric acid in the body. Well, first we'll start with genetics, because actually that's quite important. In fact, that's the most important, the family history of gout, and it might not be family history, it might be certain molecules, enzymes, alleles that are not necessarily something we can test for, but that's what I mean by genetics in terms of how does your body process uric acid. One person may be able to have a big load of uric acid in terms of food intake and be able to excrete that. The system will be able to manage with that. Whereas somebody else, if they are a little above or actually even below a certain homeostasis level, that may result in a flare of gout. So genetics, very, very important. And one of the ways we ask about genetics is essentially family history, because those alleles, genetic type of testing isn't particularly clinically available and applicable. So the best way to ask is family history. Now, age and sex, very interesting. Men are 3 times more likely than women in the early stages of adulthood, and 30 to 50 is the kind of like the main time of the time when males tend to have their gout episodes. Women definitely will have gout much more so post-menopausal, because they've lost their estrogen protective effect. After 65 or so, we see that the levels even out, male and female. So that's how that is the sort of strata in terms of the age and how it affects the different sexes for gout manifestation. Medical conditions are really very important to pay attention to. A lot of the metabolic syndrome type of conditions, high blood pressure, diabetes, obesity, as well as chronic kidney disease, are certain conditions that are making one more predisposed to have this particular phenomenon. This is a very short list, just 3 medicines I put on here, but there is a huge long list of medicines that can potentially aggravate uric acid elevation in the bloodstream. Diuretics are an important one, beta blockers, ACE inhibitors, these are fairly common in use of hypertension.
What are examples of ACE inhibitors?
Well, there are actually quite a few ACE inhibitors at this point, but basically and they have a lot of different brand names as well as generic, but they're used primarily for lowering blood pressure.
Oh, wow.
So diet is, of course,
Question, what is a diuretic? What is it?
it's basically a water pill.
Okay.
So some of the more common ones, you might have heard of furosemide, which is Lasix. That's a pretty common one. And then there are others that are actually sometimes even used for high blood pressure management. They are very low level diuretics, but sometimes that is enough to kind of cause a problem. Diet is, of course, something that we focus on so much because that's something that we can maybe control. A lot better than we can control genetics, age, sex, medical conditions, and sometimes medications. So diet is I've just written a little bit about it here, but essentially there are various foods that are basically rich purine foods that are going to break down as uric acid. And that is what results in a problem with gout when the food, especially things like red meat, certain types of seafood in some people in excess. And that excess is very difficult to determine for one person what that is versus for another. But in general, I usually tell people to have a plate and have basically make that into 4 portions and put your meat into 1 portion. And that would be considered a portion, so that as opposed to having a steak, you're having a small portion of that along with other foods, so that you basically don't at one sitting give yourself a rise in your uric acid from the breakdown of what you will be eating. Alcohol, of course, is one. High fructose drinks, which are basically sugar-related sodas, are actually also very, very commonly associated with problems with gout attacks. Prolonged fasting, interestingly enough, post-operatively, when you might have to not eat after some kind of particular cardiac surgery or gallbladder surgery, you see people having gout attacks because they're actually having a sudden drop in uric acid. And that's what it is. It's a sudden rise or sudden drop in uric acid that can lead to a flare of gout. So that keep that in mind. Overeating, I think that's essentially associated with some excess of uric acid. Dehydration, very important, because once you have something in your system that you need to flush out and get rid of, what better way than to hydrate yourself with water to try to flush that out. And so that's really important. Those who might not even have a big load of uric acid, but unfortunately are very dehydrated, gets concentrated in the bloodstream, and that may result in a particular problem with a trigger for a gout attack. As I mentioned, a recent surgery can trigger a gout flare. Most of the time that's from issues like being without food, and other times it can be from some sort of surgery that was done in that particular area. An injury to a particular joint region may also sometimes serve as a trigger to an attack of gout, particularly in an area, for example, in the big toe, when someone is walking and they injure themselves, or they're walking with very uncomfortable type of shoes, it's kind of causing a micro trauma in that area. That sometimes causes a recurrence of gout flare.
What are the most common areas of attack?
Yeah, most common area known as podagra is the big toe, the first big toe. That is the most common area. Very commonly, gout will affect the lower extremity joints. So it will be either the toe, ankle, it can even be tendons. associated with the joint, so it could be like an Achilles tendon or a particular, so it doesn't always have to just be the joint, it can be an apparatus surrounding the joint, such as the tendon. So, complications of gout, recurrent gout, flares in the joint or tendon more than 2 times in a year is something to basically start to be concerned about how to manage that particular condition. And I will go over that in a little more detail. Advanced gout, when you have nodular deposits of uric acid, here is a picture of a tophus, which is this nodule. And you can see this is actually in the toe area. You can see a little bit of a yellowish, kind of yellowish whitish. That's the chalky material that can sort of be seen, sort of translucent under the skin, which is actually the uric acid tophus. It's just almost like a chalky material. So that tophus is what we are concerned about because of joint damage that is occurring. And it's also an indication for us of the chronicity of this uric acid deposition. Kidney stones is yet another not related to joint complication because uric acid can deposit in the kidney and result in uric acid kidney stones. So that's a very important thing to note. So clinical presentation of gout, I think we said the big toe can be involved. This is actually an amputated area, but it's again an area that's been involved. Here's the hand. And we have these particular joints. You can see there's a little bit of a yellowish tophus here, but look at how incredibly swollen compared to this joint. You have very angry inflammation. Very angry inflammation. So diagnosing gout requires a very careful exam, very thorough medical evaluation with diagnostic tests. And of course, getting the history is key because a lot of what we hear will help us understand what type of inflammatory process might this person be having based on what's going on in the history. And then, of course, diagnosing it with blood tests, with x-rays. These are the things that we do. Rheumatologists, such as myself, we work with diagnosing different types of musculoskeletal conditions, especially arthritis. And so this is one of them. Joint fluid analysis is sort of the gold standard. It isn't always done because sometimes the joint is too painful or the joint is too small to be able to retrieve fluid in that particular area. But that has been always the gold standard, which is withdraw fluid from a joint that is extremely acutely swollen and evaluate that under the microscope for these particular monosodium uric acid crystals, which can be seen many times intracellularly. And that is your diagnosis right there. But other than that, we have other surrogates, which is obviously the exam, which shows this particular, typical picture of gout, as well as checking the uric acid level and seeing what that is, if it's elevated, checking inflammatory markers of blood tests that we do, such as the sedimentation rate, C-reactive protein. These actually are very helpful to explain to us how much inflammation may be going on in the blood. They are non-specific, not just for arthritis, but with that whole clinical scenario, those markers help us to understand how much inflammation is going on. Again, imaging and diagnostic tests, such as x-rays, may help to understand how much disease, how much joint erosive changes are taking place. Ultrasound can sometimes be done, MRI. There's a much more refined test known as DECT-CT, which helps to visualize the uric acid crystals in various areas in the body, not just the joints. So get to the treatments, and I would like to mention that, first and foremost, acutely, we go after reducing inflammation and pain. That's the first thing. When someone presents with some sort of an inflammatory gout, we would like to, of course, bring down the inflammation and thus reduce the pain. And how do we do that? Well, many a times patients themselves, or maybe they have spoken to someone and they've started taking some sort of anti-inflammatory, which is essentially a non-steroidal known as NSAIDs, a non-steroidal anti-inflammatory drug. All the ones that we have over the counter, such as ibuprofen, naproxen, Advil, Aleve, Motrin, all of this is in the category of NSAIDs. And these are helpful to some extent and can be useful to reduce inflammation. Sometimes the amount of inflammation is so high that none of those medicines, even in a prescription strength, may be quite as effective to reduce it. Then we resort to some other medications or use in combination with the NSAIDs. One of them are the corticosteroids, which is basically prednisone, Medrol, these type of steroids that we use in our musculoskeletal world, whether it be in the form of an injection to the joint, in the form of using a pack called a Medrol dose pack or tapering course of prednisone orally. That can be done occasionally. Even an intramuscular injection might be given so that the medicine goes through your system and calms down the joint inflammation. Obviously, corticosteroids have many, many uses, but to use to reduce inflammation in gout is something that we definitely utilize. Colchicine is a specific medication that we use primarily to sort of calm down a gout attack that is about to form or forming. So it's quite useful to almost abort that really inflammatory reaction that kind of becomes like a very, like a crescendo type of reaction. It just calms it down because there are these, when cells divide and kind of multiply and divide, as we say, they have to kind of, one cell becomes two, so they kind of go like this, and there are these tubules in the cells that actually allow them to replicate very quickly. So colchicine stops that tubule replication and kind of debilitates that whole process. And so that's how we're able to calm down that whole explosive reaction as it's happening. So it's quite effective initially at the start of an attack of gout. It's not really used for other inflammatory arthritis because it helps for this particular one. It is generally not used in high doses because at some point, quite some time ago, there was a kind of a practice of using it like every hour or until you either have nausea, diarrhea, and GI symptoms to calm down the attack. Well, we never do that at all anymore because that is really the problems associated with use of that medicine that become a lot worse than the benefits. Generally, we use it in a very defined fashion for a short course of time to just abort that active inflammation. And sometimes we may use it for a little bit longer to transition when we are using the actual uric acid lowering medication. So those are the anti-inflammatory medicines. In between that, before I go to uric acid lowering medicines, I want to just mention lifestyle changes because unfortunately, medicines alone are not the answer because the problem is, as you know, is you're ingesting something, it's breaking down into uric acid, and if it is just over a certain limit for your own body's homeostatic limit, that's when the problems occur. So it's important to make certain lifestyle changes if there are certain modifications to be made. So if one is someone who's prone to drinking a good amount of alcohol socially or otherwise, they would have to be advised to learn to limit their alcohol intake, improve their hydration. That would make a huge difference in their whole manifestation of this condition. Of course, certain foods that they eat, and there are lists on the internet of all different types of foods and what may be more provoking for gout. Now, I will say this, that each individual over time gets to learn what foods are more provoking for themselves versus someone else. So I have patients who come in and will say, yes, I had exactly this, like maybe shrimp or some particular seafood, and this is what did it, versus what might not be a problem for them. Maybe red meats are not a problem for them. So each person might have certain things that they're finding more problematic for themselves. But in general, this is a very important list to look at and kind of assess based on what you're eating, what you're doing, and kind of make certain changes based on what can be changed.
A question, in your use of the phrase excessive red meat, Are you referring to like a preference for rare cooking of meat versus well done?
No,
Or
no,
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 it doesn't matter
Yeah.
how good it is. cooked,
it's still
how-
being broken down to uric acid. Purines is still being broken down to uric acid.
Okay.
Yeah, I'm just separating that from chicken and fish.
Shellfish more of a problem than just regular fish?
Generally, it seems to be, yes.
It seems to be.
Yeah.
Do they find that people who live by the sea tend to get, because quite often
So it's
it's
interesting.
cheap for them, the
Yeah.
seafood, and they
So-
eat a lot of it.
Right, so that's why I mentioned genetics first, because genetics, there are certain things, right? I mean, obviously, I'm sure for years and years, those who lived by the coast and ate certain diets, there must have been some changes in their genetic profile that allowed them to have certain alleles that allowed them to break down those and solubilize them better and not have.
Oh, so that you don't really see a high
Well,
concentration.
I don't know that there's any study being done, but I would say that in general, almost you would over time, you would definitely have a change in diet. If some population in around the sea felt that, oh, this is this is what's happening to
They're all
our us.
limping around with.
Oh, we bring around, yes. But I want to really bring across that moderation. That's why I said, take that plate, cut it in four, and put your meat, and put your vegetables, and put your carbs, and put your sweets in a particular way so that you don't end up having one big plate. I mean, obviously, if you were on Atkins diet, you might be in trouble if you have a predisposition to that. So that's the kind of thing that you have to be mindful of. Now, uric acid lowering medications are obviously what we go to try and lower the uric acid once we have diagnosed gout, once we've seen that you are having attacks over time, which are persistent. And the goal of lowering uric acid with uric acid medications is to lower it to less than 6. That is very important because any level higher than that is known to, in studies, be associated with deposition in the organs, obviously comorbidities, along with flare of the joint, which is what we're not going to have. So what are our lowering medications? Uric acid lowering medications. Allopurinol has been around for a long time. We have used allopurinol and we continue to use allopurinol as our main medication to lower uric acid. Yes, we have to watch the white blood cell count after having used it for a month or so. Yes, we monitor labs every so often. Yes, there are certain genetic profiles we may have to test for in certain type individuals from certain areas to make sure that they are able to utilize that medication without any problem. But in general,
Oh, what was the other thing besides white blood cell count that you watch?
monitoring labs in general, but that monitoring the labs
Oh.
such as kidney function, liver function, white blood cells. But occasionally there are some circumstances where white blood cell count may be lower without allopurinol. So we checked for that. It's not very common, but anyway, that's part of our monitoring. Along with, of course, monitoring the uric acid as we're going along with the medicines, because we titrate that medicine over time. That's another important thing. When we're using a medicine to lower uric acid, the key thing is nothing can be done suddenly. As you know, I mentioned a sudden decrease in uric acid will also potentially result in a flare. So the way to do it is kind of in a very individualized fashion, specifically for that patient, to make sure that we transition from calming down the flare that they're having, making sure the flare is quiet or almost quiet, perhaps using colchicine as a transition while we introduce allopurinol at a low level, and over time adjust that level of that medication based on how they respond, what the uric acid is doing, and so on and so forth. So it's not just a here's medication. It's really kind of like you need to know when to bring on a uric acid lowering medicine. It's quite important because so many times we find patients come in and they are somehow started on a uric acid lowering medicine when they're acutely flaring, and lo and behold, that results in a prolongation or worsening of their flare, and it just results in a, non-compliance, because you're not going to take medicine that's going to actually aggravate your problem that you're having. So it's very important to introduce it in the appropriate time once you have calmed down the actual flare that's happening.
A question.
Yeah.
You showed the photograph before of the person who had in the gout in the fingers.
Mhm.
And my question is, when that occurs, that almost always necessarily includes gout in the lower limbs?
Not necessarily.
Or, no, because initially you said it typically occurs
Typically,
first in the
yes.
lower limbs,
Yes.
right?
So it's possible this could be the same person and they have their feet involved as well as their hands involved.
Okay, but it could also be possible they have the problems only in
Only
the
the
hand.
hands, yes.
Okay,
Yeah. More common in lower extremities, but it can occur.
okay.
So we are back to uric acid lowering. We got the allopurinol, are tried and tested, has been around for a long time. What if you fail allopurinol? If you've gotten it at an optimal level, uric acid is perhaps not coming down as well as we would like, or gout flares are occurring despite use of allopurinol. So then we have certain other medications. There's a medicine called Uloric, which is basically the fluticastat. And that is another medication that is used for uric acid. And we do use that in certain conditions, again, a pill. Again, can be titrated. Then we have probenecid is actually a medicine that's a little different because it actually allows for more excretion of the uric acid through the kidneys. And sometimes we use it, but we have to use it with caution because if anyone has any problem with their kidney function, we probably wouldn't go there. So but there are some times when we use a combination of something to flush it out of the kidneys as well as to reduce the uric acid in the blood itself with the pill, allopurinol, if it goes as that. Pegloticase is known as Pristexa. It is a infusion medication. It is used primarily for those who have significant gout, tophi, resistant to treatment that we have tried before, elevated uric acid levels. And it is very effective, but very expensive, and is not something that we would ever consider until we've tried the other treatments first. Unless there was a contraindication for some other treatments and the patient had severe gout, for which that is an indication. So, right. So consequences of gout chronically, well, if you have chronic pain, which tends to be actually sometimes worsened at night, chronic painful flares at night, disturbed sleep pattern, negative impact on family, social life, negative impact on mental health, increased costs by not being able to go to work because you have a problem with a particular joint, you're not able to walk, you're not able to do your regular activities of daily living, perhaps. ER visits, hospitalizations, if it's something that's severe and there's a complication, all of this will lead to increased costs. Tophi, as I mentioned, can lead to bony erosion, which can lead to joint destruction and damage. So that's very, very important. And of course, increased risk of overall mortality is noted in gout patients. So that's actually where I want to go to next, which this is a kind of a very interesting slide, and we are focusing more on this aspect. Gout being something that's local to a joint, causing joint pain is one aspect, but understanding that the consequences of chronic elevation of uric acid with chronic episodes of gout may be resulting in issues with these type of things. So increased mortality. In fact, there is a study that suggests that threefold risk of death in patients with visible tophi. All-cause mortality increases by 9% with every 1 milligram increase of the serum uric acid level. So that's very important to note when it comes to overall health and well-being and its impact with gout and uric acid being untreated. Renal, as I mentioned, there are various reasons for issues with elevated uric acid and kidney problems. One of them, of course, is kidney stones. But in fact, we know there's an independent risk factor for onset and progression of chronic kidney disease, with elevated uric acid. With cardiovascular system, there's also independent risk factor for hypertension, heart disease, stroke, and there's also a 2 times greater risk of cardiovascular mortality with elevated uric acid that remains untreated with tophi present in the system. Metabolic, there is an increased risk for development of diabetes type 2 that is seen with those who have gout that is untreated. So here are some very interesting pictures of showing the uric acid crystal deposition noted to be systemic in the organs. So here is the kidney, basically cut transversely, and this is the nephron area and through here. And we have right in this region, which is known as the pyramid of the kidney, uric acid tophus that is deposited in that area and results in chronic kidney disease.
That would be from someone who's suffered this for a long time.
Yes, and they have high uric acid levels, which are now not only just depositing in the joints, but in fact depositing in the system.
But they've been in pain a long time. They've had flare-ups,
Sure.
flare-ups.
Yeah, but I mean, it may, long time is somewhat relative. I couldn't say that, oh, this would only occur to someone who's had this for greater than 5 years. It's a question of what's their uric acid level, how long has it been elevated, how symptomatic have they been all this time, and what type of treatment have they at all been on. If they're untreated over time, these are the kinds of things that can happen as a result of uric acid that's elevated from the bloodstream depositing in different systems and resulting in systemic conditions and systemic problems. So chronic kidney disease. This was actually something that is a specialized type of CT scan that I think I'm not sure whether it was a experimental study, but they must have taken a patient who is basically having high uric acid and compared it with somebody else who has normal uric acid and seen that this is the uric acid right here, the uric acid deposition throughout in that region of all along the joint space that is occurring with the person who has a high uric acid randomly. Now, cannot tell you with this particular patient that they had necessarily symptoms. There are patients who don't necessarily have symptoms. It's just depositing in that area. If it's depositing in a kidney or an eye or the heart, there can be major consequences. Surely it can also affect the spine as well, but it may not necessarily, unless it becomes inflamed, it may not necessarily cause symptoms of some sort of acute pain. It may cause slow destruction from the tophus being there. Here is the aortic arch, so it's the heart right here, and we have apparently again a DCT, the DECT scan showing a uric acid crystal deposition in the heart in someone who has had high uric acids that are not treated over a long period of time. Uric acid crystal deposition in the eye, just to give you an idea that these are not even organs that we are necessarily even following, but this is what happens when uric acid just overflowing out of.
This picture, is that something a regular eye exam shows?
I don't think so. I think this would have to be something that you would have to have a specialized type of study or imaging study to see that this is uric acid. They can show inflammation with some sort of a regular eye evaluation, but what's causing that inflammation would be a combination of history and further diagnostic imaging and testing.
Okay, I just wondered because of the photo there, like, they take all those
Yes,
special photos.
yes, yeah. So I mean,
That's not one
clearly,
of those.
everything has to be in the context of the history and the whole clinical scenario for the person. So,
But can I ask you, like,
yeah.
did somebody just have it in the eye and not have it anywhere else? I mean, is that possible?
I don't think so.
Okay.
Yeah. I mean, in general, they would have to have high uric acid, and something must have brought us to know that, and that would have been some sort of leak in nephropathy. A kidney, if it's not gout, if it's not acute or chronic or tophaceous gout, it might be something like kidney disease. And then from there, you're seeing that, okay, there's this problem going. But most of the time, we're talking about someone who has one attack and maybe then has a couple of attacks, and then over time kind of just manages and decides, or for whatever reason, has not really had a good response to some particular treatment that was tried, and may not necessarily want to move on to other treatments, maybe disheartened. That's the importance of moving on and treating with appropriate medications. We have essentially 3 levels of medications that we can use other than reducing inflammation first. So you do the acute putting out the fire, but then you have to focus on what caused that problem and then start to manage it properly, because these are the kinds of consequences over time that can result from not managing it. So that's up. So new therapies are being studied. There are more sophisticated diagnostic modalities, the DEXA scan being one of them that I was talking about. And of course, nevertheless, with all of the advances, there is essentially the most important thing is the emphasis on patient awareness and education, because that at the end of the day is most important. In some ways, unlike some of the other inflammatory arthritis conditions that I treat, which are more chronic and continuously building up, uric acid deposition causing gout may be something that might occur once and then not for quite some time. So it's really an important thing to understand. Once you've had 2 episodes over a period of 6 months or a year, it's very important to assess that whole scenario, see what's going on, see if there are certain lifestyle changes or some other medication changes or something else that are interventions that can be done that are not medicinal. Of course, you can try that. But in general, most of the time, there are certain genetics involved, and that leads us to require utilizing a medication to lower the uric acid and treat it accordingly. So I think we're done. I'll open it up to questions if you have any others.
What kind of food causes the uric acid?
So
Tomatoes?
So basically what we're finding is the vegetables are much less likely to cause problems. Of course, tomatoes are in the nightshade family. So that is another whole story, and you know, people with just generally arthritis in general might avoid nightshades for what different reasons. But in gout, the primary reason is for whatever reason, your level that your body can keep your uric acid at a certain level, which is okay for your body. If it goes above or very below that, that may cause a problem. So there are, it is, you know, there's definitely genetics involved, because what is that level, what instigates a flare is very different for each person, or for many people. Everyone in this room, there might be a different point where that might happen because of certain things that we, conditions that we have, medicines that we take, genetics, all of that makes a difference. And then you add something that you have control over, which is food. And then you take a certain amount of that food, which you know might break down, will break down into purines, and which will then break down into uric acid as the end of that. And that may be too much for you for that particular period of time. So that's why it is somewhat individualized, but at least you can know, like, oh, these are the foods that I have to watch out for. And what do I know from my experience as to which one of these seems to be a problem? Some people are able to identify it because they feel something getting flared if they've had too much of a particular thing. And others might just have after Thanksgiving, after Christmas, that sort of thing, where basically you've had your, you know, turkey, and you've had your wines, and you've had your good amount of things that are rich foods and alcohol, back to my first slide. And that might be a combination of those things was just a whole lot for your system.
Doesn't that gout have higher instances of other inflammatory arthritises as well, or is it separate?
Not usually, actually. No, I mean, if they have some other things that can happen, it's not like exclusive that, oh, you're protected against psoriatic arthritis, rheumatoid arthritis, and the like. But in general, no, they're not more predisposed, because this mechanism is specific to this particular substance that is resulting in a type of inflammatory scenario when it's depositing. But hydration is key for practically everything. So one of the first things that we recommend for everyone, is essentially make sure you hydrate yourself well, essentially all the time. And by that, we also want you to, lower your dehydrating beverages, which would be alcohol, and lower your sugar fructose, include, kind of beverages, which is all the sugary type of drinks, including fruit juices, by the way. That's all sugar with not anything to bind, there's no fiber. So that's a kind of like a big load going into you. So if you hydrate with water, you automatically, hopefully, are lessening some of the other beverages that you're taking, and that will help you.
Also, sugar in general is not great for people with.
I'm taking for psoriatic arthritis, I'm taking hydrate. Yeah.
But that's a totally different arthritis, right?
Yeah.
What you said, psoriatic.
Then the doctor, I think prescribed then he gave me, you want a Humana? And I said no, because I didn't feel good.
Oh,
That's why I'm taking that.
I see. But not related to gout. You're drinking all of this for some other types of inflammatory. Yes.
If you had a patient who's had 2 or 3 episodes a year or 2 apart, would you put them on daily allopurinol?
And it also depends on what are the joints involved, how.
Just in the toe?
Just in the toe. And 2 or 3
And the
episodes. in the
serum
hip.
level is 6.7 or something?
Yes, that was my next question. What is the serum uric acid?
Would you put somebody like that on allopurinol every day?
And they've been have had 3 attacks in a year?
I'm sorry,
3 attacks in a year?
I've had 3 attacks in 5 years.
Oh, okay. Okay. Well,
And it's usually when I'm binging on seafood by the ocean.
right. Yeah, so I mean, that's, in that case, with that level, that sort of almost borderline level of uric acid, you can work on doing certain
Lifestyle.
interventions to lower the uric acid on your own with certain lifestyle changes.
But 300 milligrams a day is excessive.
No, no one would give 300. You could even start at 100 milligrams. You could even start at
Can
50
you cut the pill
milligrams.
in pieces?
There's a 100 milligram tablet.
I have 300, but 300.
Yeah, no, but there's a 100 milligram tablet. Obviously, someone gave you 300 milligrams, but in general, we may start someone on 100 milligrams.
That's what I'm asking. Can you cut the pill?
Yeah.
Okay.
But 300 to cut it to 100 is kind of silly to do and won't be accurate, but 100 can be actually used. It can even be used at 50 if you take 100 and cut it with a pill cut. So the issue is to monitor over time, and if despite interventions, you are still having the problem with the attacks, it would be wise to use a small amount. But there are some individuals, I had a patient who came in just 6 months after he was definitely hell-bent on doing interventions, lifestyle modifications, lower uric acid, I think it was 5.7, and clinically did not have any further episodes. But he too said, if I do this particular thing, it will come on. So as long as you're aware of what is that particular problem that brings it on, and you can control that, that is something that you can control. And as long as you control it, that's great. There are several patients who unfortunately don't have, at some point, they're not clear what's causing the problem. It's just happening, like constant flares. It may be every 4 months, but it's still without any rhyme or reason, elevated uric acid. In that scenario, it would be very wise to treat. Sorry.
Can high blood pressure, high blood sugar alone be a?
So we see that diabetes is something that is seen often kind of floating around in these particular gout patients, but it's not necessarily the diabetes itself is a risk factor for gout. No.
And can gout be just pain in one joint, but none of those other things like the rash or the lump or any of that other stuff? Or would it typically
Generally
soon
not, because
add more?
so pain in a joint in the toe is very possible with osteoarthritis. It's very possible with rheumatoid arthritis or even psoriatic arthritis. I mean, there are lots of degenerative osteoarthritis, as well as certain inflammatory arthritis conditions that can cause problems with a particular joint being painful.
And those can be just like in one toe and nowhere else.
So that's where when someone comes in specifically with a big toe that's swollen, inflamed, saying they can't put a bed sheet over it because that's how painful it is, most of the time, we are pretty focused on is this gout. But there are patients who come in with psoriatic arthritis that's very angry. And it may be that it might have affected their big toe, kind of unusual. They may start to have other things like skin psoriasis on their elbows or extensor surfaces. So other clues, history, all of that is helpful to, along with diagnostic tests.
And if it's actually a nerve issue, would the symptoms be a whole different thing?
A nerve issue in the foot?
In the foot or the toe? Yeah.
Yeah, so most of the time when it's nerve, it's going to be sharp shooting, tingling numbness, those kind of symptoms. It's not going to be like, oh, I have a red hot, painful joint that I can't move because it's basically that swollen, it's that painful. And osteoarthritic changes may be that you just have certain bunion formation that's painful, but it's not to the point of I can't put a bed sheet over it. Yeah, it requires a little bit of, evaluation with certain testing and imaging that will be helpful.
Is cherry juice a wives' tale or?
I think it's definitely fine to have cherry. There are definitely certain substances in tart cherry that actually is helpful for gout, as well as some other types of conditions to try and just reduce that whole, kind of reduce the uric acid and reduce the inflammation. So I would definitely, if anybody wants to have it, it's not a problem. It's not a contraindication, but I would definitely advise the patients to not just focus on that as their means of reducing uric acid.
Well, it'd be probably wiser to consume the fruit itself instead of the
There you
juice, 'cause
go.
it's- And you go to Michigan and go for the cherry festival and load up as much as you can and come back. And it also helps your melatonin level and sleep too, so.
We were talking about Nightshade, the Nightshade family. I know there's some kind of link with arthritis, so if a person has arthritis, that might contribute to make it worse. But if a person doesn't have arthritis or isn't inclined toward that, are the Nightshade family still, should you try to?
I mean, there's some very good benefits of eating tomatoes.
Yeah,
Like
tomatoes,
beans
green
are-
peppers, all those, right?
Yes. So I would never say, oh, remove that from everyone's, no.
Well, I don't mean remove it, but
Yeah.
I've been reading and learning about that just in the last few years. It's very interesting, but there's so much information. So it's interesting from your perspective, what you see as far as in general to.
So I do know that there are certain people who may find that certain foods aggravate them. I always advise patients to see for themselves, I'm not talking about gout per se, but someone who has rheumatoid or psoriatic arthritis or some type of inflammatory arthritis. It's not going to be that there are certain linkage with certain types of food. Of course, an anti-inflammatory diet, which everyone talks about, is a great thing to do for pretty much anybody, which is basically a Mediterranean, your green leafy vegetable, you have your olive, you have your nuts, those kind of things. But in general, as far as specifically condoning a particular type of category, like in the Nightshade, no, I would never mention that to anyone unless they themselves felt that is something that is aggravating.
Can I comment on that?
Yeah, please.
Well, so I don't suffer from gout. My father is older and disabled and suffers from certain things. So I'm, trying to do better myself so I don't run into situations later. But I would say there's a massive difference between the food that we have and grow here and versus other countries, such as like, you want to talk about tomatoes. I mean, the kings of making the best tomato dishes are Italian. So, I mean, if you love tomatoes, I mean, buy some organic Italian tomato sauce and make a pasta dish. I think it'll be very delicious. And I just think the quality is night and day difference between what we have here, which is highly genetically modified and loaded with glyphosate. I mean, I don't think those things are going to help your gout or chances of getting gout, but
brought it up because I am a vegetarian and I eat a lot, and I eat a lot of that stuff. But now there's all this information about all this other stuff, and I'm thinking, as I'm aging, like, oh, could that actually be that if, for, when they're in season and I'm eating a ton of the nightshade, I'm maybe on a nightshade diet, I don't know.
And
Not
are you
really.
experiencing a
Not really.
flare of
Yeah.
your joint pains when
So,
you're doing
so it's the
that?
other way around, I'm not experiencing it, but could I be tending my body toward getting in trouble by doing that?
Not
Whereas
that,
I
not
think
there,
the
I don't
takeaway from
see,
you
there's,
is,
yeah, there is
I-
nothing that indicates that in any kind of
Yeah.
study. And so for sure, I wouldn't want you to miss out on all the good qualities of all those.
And for me, you say, yep. I
But then the
agree.
question becomes, you know, is the food local and seasonal?
Well,
So are you
that's-
eating it in season is, I probably would say, also an important factor, right? So.
No longer do we have foods that are seasonal any longer. 'Cause we get it from everywhere.
Yeah, but so many years and years and they won't find any medication for arthritis. Right?
Well, which arthritis?
Any kind of.
No, because each
The
arthritis,
purple one and
each arthritis is a different kind of arthritis. Arthritis simply means inflammation of the joints. And each one of those manifestations, that's just a picture. Now, what caused that? What is the disease manifestation? What is the mechanism? And what are the treatments? Now, you mentioned certain medication for psoriatic arthritis. There are biologic treatments that are targeted for treatment of psoriatic arthritis. And those are known to be, you know, maybe one was not suitable to you, but those are known to be effective and more targeted as treatments. If you're asking for cures, unfortunately, in our, there is not really a cure for diabetes, hypertension, you know, really any disease that we have, we first focus on what's the pathology and how can we calm it down and treat it. If there's a way to cure it, that would be amazing, but at least we have treatments. And over time, we've refined some of these treatments to be more focused on what's the pathology and be able to target that. And yes, so that's how we have some treatments. But what can we do about a wear and tear of a knee joint? Yeah, we could try certain kinds of injections and treatments and things like that, but no, there's no cure for that. Over time, when it wears out, it wears out. What can we do about, you know, our age as we age and all the things that kind of over time kind of wear out? We have certain things that we try, but there is no cure for that. So that kind of arthritis is kind of more, you know, part of wear and tear.
yeah, but the injection is no good too. You know, because you can have only twice or three times.
Well, yeah. Well, again, arthritis is a ocean of conditions. So if we talk about arthritis and what's the treatment, it can't be dealt with in that manner. We specifically have to talk about the pathology of that particular type of process and then treat it, because there's no way that we would say, oh, how do we treat arthritis and have one kind of thing that treats all of arthritis. Because remember, that's the end point. That joint that's swollen and painful, that's the end point. What caused it is what you're trying to go after. So you prevent further attacks and you prevent other joints from getting.
Can you get that from your blood test,
Get what?
the arthritis if you have it, or
There are certain types of blood tests that help us diagnose what kind of arthritis you may have. So we run those type of tests, but first and foremost is an exam, a history, which helps us clue into what may be. And then, of course, there are diagnostic x-rays, blood tests that help us understand what might be causing that particular joint to be. Yeah, sure. Anything else? All good?
I have a question. It's just regarding like sun exposure. And we're talking a lot about food, and food is grown from sunshine and we eat it and makes us healthy and stuff. I guess as we age, you know, our body to produce an adequate vitamin D level tends to go down. So, you know, that's why there's snowbirds and they go down to Florida or Arizona and they feel great and they love it and, you know, all that good stuff. So I guess like as people age, you know, monitoring their vitamin D levels, which, you know, on a typical lab isn't pulled. You have to request it or have a deficiency for the doctor to first order it. So I guess like how important is it for people to really know their vitamin D level and track it?
We see.
And then
we see
also
so
How
many.
much sun exposure should they be getting to really help with gout and other things as well?
So actually, the thing is, the problem is that the sun is one component, then it has to go to the kidneys to actually get processed and be more activated. So the problem is that our kidneys also over time has some inefficiencies, and there's certain other factors that may not lead to as much vitamin D in our serum. I think it's a great idea to check for serum vitamin D for various reasons. There's so many different systems that can be involved when the vitamin D is low. But you're right, it's not so easy to get that tested, but primaries can possibly figure out a particular code that you might maybe associated with certain symptoms that may be qualifying for checking the vitamin D, because I'll be honest with you, we've got youngsters who've got vitamin D that's low. Well, is everyone sitting around drinking lots of milk? Like our diets have changed, we're completely, there's so many people who are either maybe not lactose intolerant, maybe just not having milk for whatever dairy free. And that is another huge, that's where we get our.
Or just producing it naturally outside as well, because that's a great way to make it too.
What's that?
It's a great way to produce vitamin D, is just being outside.
Oh, yes,
20
right.
minutes,
But
20, 30 minutes a day, and you're producing several thousand
Right,
IUs a day. And
But
it's fantastic.
unfortunately, even in states and places where there's a good amount, you're gonna get a lot of vitamin D when you're out there for some period of time. Even in those cases, there are individuals that may not necessarily actually have serum vitamin D that's ideal, partly because that's the first stage. And then you have that has to go then to the kidney and actually become activated. So that's another aspect that has to be that's why it's important to check. And sure, of course, it's absolutely a great idea to have some vitamin D through natural sunlight, but unfortunately, it doesn't seem to be enough for so many of us.
I think vitamin D is associated with gout.
I have one more.
Thank you.
My sister, she has something with on her back, and she walks for a few minutes and she has to sit down because she had weakness to stand. What is this cause?
Arthritis probably in her spine, which causes central spinal stenosis of the nerves that are in the spine. That can cause those kind of symptoms. But yeah, so arthritis has so many ramifications depending on what area is involved. If you have the spine
So what
involved.
kind of doctor do you think she should? go?
Well, I think first her primary doctor, so that she can figure out who she should see, because they can examine her and decide what to do. Sometimes an X-ray of the spine is helpful to understand what's going
Yeah.
on.
Okay,
Yeah.
thank you very
Sure,
much.
absolutely.
I'll tell her,
Yeah,
go to primary doctor.
yeah, and explain to them what's going on.
Yeah.
Absolutely, absolutely.
Thank you very
Thank you
much.
so much, everyone, for coming. Yes.
Thank you.
And you had a card?
Oh, yeah, I do. Thank you.
Yeah.